need of enhancing our intervention measures to be able to curtail the spread of the virus in these two counties. And so in this regard, particularly for Nairobi County, the Nairobi Metropolitan Services has intensified community engagements. They've been able to engage all non-state actors, particularly focusing on the church and religious leaders to help us in this fight. NMS has been able to train 1,500 community health workers to be able to engage with people at the community. And additionally, they've been able to intensify the use of the home-based care program in order to be able to ensure that our health facilities can deal with critical cases only. And again, in partnership, we continue to focus on ensuring that Nairobi, the county with the highest attack rate, has the facilities and the infrastructure necessary to be able to deal with this. NMS, in partnership with MOH, continues to put in play the construction of at least 24 health centers in the slum areas, with the idea of ensuring that access to health facilities is increased. The intensive care unit and the high dependency unit in Bagathi Hospital is also near completion. And so when we take a look at the situation and from the various analysis that we have, there's really need for us to step up our guard to ensure that we continue to strictly adhere to the containment measures as advised, and reminding each and every one of us of those three measures, which include washing our hands with soap and water, maintaining social and physical distance while avoiding gatherings, and ensuring that we are able to adhere to the containment measures. We do take note of the emerging trend where we have gatherings amongst our communities, and we continue to remind you all of the protocols when it comes to people congregating together. Remember, we have 100 people who are able to attend weddings and funerals, and that those in attendance in those areas, weddings, funerals, marketplaces, any congregation like much today when we're here congregated together, should wear masks, face masks, ensure that the face masks are worn correctly. We should avoid some common practices that we've seen returning back. We've seen people gathering together, we've seen them wearing masks, which is commendable, but now we're seeing people shaking hands, and really, having that close contact in terms of hugs and shaking hands. We continue to ask for the maintenance of social and physical distancing in that regard. Another element that becomes important even as we stabilize and get into the new normal is to remember we must continue to protect our old and vulnerable people in the community, people with underlying chronic conditions. And what this means is that if you have that underlying condition and you're of that certain age group, you may not need to attend that church service, you may not need to attend that funeral, you may not need to attend that wedding, you may not need to put yourself in a place where social distancing is not being maintained. And so if we are able to adhere to these measures, remembering the role of personal responsibility, it then becomes useful and necessary in trying to flatten this curve. And as we turn now to the COVID-19 statistics, today we have only 48 people who've tested positive from a sample of 1,081 in the last 24 hours, bringing our caseload to 36,205. In terms of those who've been tested, all are Kenyans. In terms of their gender, we have 31 being male, 17 being female. The youngest is a 12-year-old child, while the oldest is 75. Distributed by cases by county, we have Mombasa today taking lead with 20 cases. And this is what we were pointing out to, that it seems that there may be a slight surge in Mombasa County. Nairobi 15, Tharaka Nithi 4, Kiambu 2, Kilifi 2, Meru 2, Machakos 1, and Wajir 1, and Homa Bay 1. And in terms of sub-county, 7 from Vita, 4 from Changamwe, 1 from Likoni. In Nairobi, the 15 cases, we have 3 from Westlands, Embakasi East and Langata have 2 cases each. Dagoretti North, Dagoretti South, Embakasi South and West, Kibra, Madaraka, Ruaraka, and Starehe each have 1 case, whereas Tharaka Nithi, we have all the 4 cases coming in from Chuka. When we look at Kiambu, in Kiambu town we have 2 cases, we have one case in Kiambu Town, one case in Limuru. In terms of Kilifi, we have a case from Ganze and Kilifi North, each having one case. And in Meru, the cases are from Imenti North and South. In the case of Machakos, we have a case from Athi River. The case of Wajir, we have it from Wajir East. And in the case of Homa Bay, we have Homa Bay Town. On a positive note, 176 people have recovered from the disease, of which 45 are from the home-based care program, and 131 have been discharged from various hospitals. In terms of our recoveries, they stand at 23,243. And we continue to thank our healthcare workers for the good work that they're doing. In terms of fatalities, our count today is 624, having had an additional 2 patients who have succumbed to the disease. And our condolences go to the family and friends of those who've lost their loved ones. We now welcome a session of Q&A.
Good afternoon. My name is Eunice Omolo from NTV. I have 2 questions. It's good you've mentioned Mombasa. Recently, there was a mass gathering in Mombasa. And there's this feel that people are letting down their guard in terms of taking the measures. And once this example is being set by our leaders. So what is the Ministry of Health trying to do to ensure that your people are protected? Because there's that trajectory of perhaps you're going to have more cases in October. My next question is on Nairobi County. The health workers are on strike. What is the Ministry of Health doing in conjunction with NMS to ensure that services are not disrupted in public hospitals? Thank you.
Good afternoon. I'm Purity Muse from KBC. Today, the World Health Organization reported quite a huge number of COVID-19 cases in a single day, about 300,000 cases. My question would be, what does our curve look like? And then there was also a promise by the ministry to ramp up the capacity, the testing capacity in the country, but we are still seeing in the last 24 hours only 1,000 samples were tested. Where are we in that regard? Because you had said it's helping in knowing the number of people that have been infected this far. And then the last question that I had would be to do with the fatality, the recovery rate in the country right now. The people in different health facilities, what is the recovery rate in the country as regard to COVID-19? And again, the vulnerable, in terms of the children as well, how many children have succumbed to COVID-19 and how many have recovered? There was also a question that I was following up on the explanation on why the couples are not both getting COVID-19, the disease, because once tested, one partner is positive and the other one is not positive. Is there a scientific explanation to that?
Good evening. My name is Elfas Lagat from Citizen TV. Today being day 11 where the positivity rate is below 5, can you say that we're getting to a point where you can say that the curve has flattened? And my second question is a follow-up to Omolo's. It's not only Mombasa that we're seeing political gatherings, but it seems that political activities are back with a bang. Is it that the health ministry has allowed politicians to flout these rules, or is it a scenario of an animal farm where some animals are more equal than others? Thank you.
Zainab Mohammed, TV47. Regarding funding, the threats that donors will be withdrawing funding for malaria and HIV and AIDS, I'm made aware that there was a meeting today by the Ministry of Health and AMREF. So as media would like to know how far is the ministry dealing with this and what is the end result of the meeting. Thank you.
Hi, Winnie Lubembe from Ibri TV. First question is about a case in Turkana and Trans Nzoia. We've not seen a bit of political rallies there, but the numbers are high. What does that mean? And then the second one is again on Omola's question about political leaders. And we keep on saying we need to follow the rules, but it seems like the rules apply to, the common Mwananchi compared to the political class. So shouldn't we have like serious measures then taken against them to ensure that then they do not put people's lives at risk? Thanks.
Fantastic. Today is especially good because we have a good set of questions, and so we'll give it a go and get those answers for you. And I think one of the most common questions, which is a thread amongst all the media houses here today, Ebru TV has asked it, Langat asked it, Purity mentioned it, the issue of gatherings, the issues of flouting protocols, the issues of ensuring enforcement when it comes to people congregating together. One, the ministry continues to maintain that we should not be complacent. COVID is still very much an issue and a challenge, one globally. Thank you, Purity, for reminding us that WHO noted perhaps in a long time about 300,000 new cases. So yes, COVID is still an issue globally, and it is still an issue within the country. We have made progress in terms of trying to ensure that the curve is being flattened. We've made progress in terms of our interventions. And what remains clear as day and night is that this progress will be undermined if we continue to gather, but most importantly, if we continue to gather and not observe the measures that should be, observed. And so what this means is that, and I want, to really throw it back to you because I think Ebru was asking in Turkana, there are no rallies, therefore what's going on in Turkana? The idea is, the evidence shows us that COVID is transmitted, through droplet transmission, and it's that situation where you're together and crowded into a space together facilitates that transmission. And so the MOH maintains that our protocols stand. When you're in a gathering, ensure you have your mask on. But most importantly, nobody forces you to be in that gathering. Nobody forces you to be able to congregate into a group. Remember, personal responsibility is absolutely crucial. And so if you're going to be in any space where you feel that social and physical distancing cannot be maintained, then you need to be masking. You need to avoid the greetings. I've seen people hugging each other and giving each other high fives. That's a very easy way of transmission for COVID-19. And so really what we have in response to that is personal responsibility remains. With regards to enforcement, we always call onto our leaders and our elders to really demonstrate and to help us in terms of ensuring that there's adherence, and we continue to maintain this call to all leaders in all platforms, national, county, to just ensure that really they're meeting us halfway, so to say, when it comes to ensuring that we are beating and defeating this disease. When it comes to the issue of Turkana, like I've mentioned, Turkana and Mombasa, we have our teams looking at that. Our case management teams are trying to find out what exactly could be happening there. We are linking up with the county teams as well to find out, could it be a situation where there was a super spreader event? I'm sure you've seen in different countries where people have either gone to church or people have had a certain form of event that has led to an increase or a surge. And so teams are looking to investigate, and we have our eyes on that situation as it evolves. Regarding the issue of discordant couples, I think this is an issue that DG will add on and touch on. But the idea is discordancy is not new when it comes to public health and medical practice. It happens. And I think the last time this question came up, we did tell you that studies are underway to determine what exactly is happening. Again, remember, if we take a common ailment like the flu, you can be in a household, with your husband, you can have the flu, he may not have the flu. But at some point, perhaps, he might have had the flu and was on a pathway of healing and recovery. And this is one of the, reasons that evidence has given us as to why you can have discordancy. It remains an issue that is being studied. As we continue adding on to our evidence box, we hope to get answers to some of these questions. When it comes to children and COVID-19, again, interesting news here. Previously, remember, children were vulnerable. We were protecting them. But I'm made aware that there are studies, particularly one that was released last week, that children may spread coronavirus, but may more or less, have less impactful effects on their health. And that's one of the recent studies that has come out. And so again, we are watching, evolving, trying to collect all the evidence, so this evidence can inform policy back here in Kenya. There's an issue on the recovery rate. I'll have the DG touch on this in terms of the latest statistics of where we're going. But I can say from March to now, 7 months in, having engaged with this issue, our recovery rates continues to improve. I remember there was a time we were in the lows of 40, 50. Most recently, 2 weeks ago, we were at 61% in terms of recovery rate. And so, again, DG will add on to this space. Testing capacity, indeed, an issue that requires to be addressed, and it requires to be addressed in a manner which we are looking to answer the question, how can we ensure as a country we are ready for testing now, this week, but also 6 months from now? Are there issues we need to change when it comes to what we test, how we test? Is there a need to focus on testing asymptomatic people? And we've had, evidence from different groups that perhaps as COVID continues, now that it is here with us, we need to remodify our testing approaches and focus on that person who is showing up in the health facility and requires care because they've come to the health facility and most likely because they have either a moderate or severe case. What that means is that it may be about time we have a conversation on, do we test each and every one of us who are walking around and who are asymptomatic? Of course, again, disruptions in supply chain continue to hamper our capacity, and DG shall be able to add on to that. There's the issue of NMS and the strike and disruption of health services. We're quite pleased with the union and the stakeholders in NMS because they continue to engage to be able to really, dot the T's and I's of all the issues that have been raised. Most recently, Cabinet approved workmen's compensation for healthcare workers, and so again, that issue was settled. Any other remnant issues that deal with promotion are being handled by those teams, and they're in conversations with the union bodies there. When it comes to Mombasa, I think Eunice Amolo, was trying to define some causation pathway, that there was a rally in Mombasa, and perhaps that's why the cases have gone up. Again, an issue that our team is looking into. But remember, it is not just political rallies. If I'm getting it right, it seems that we're all trying to pitch, political rallies as a cause of, an upsurge. It is any gathering, be it a political rally, be it a funeral, a wedding, anywhere where you're congregating poses a risk in transmission. And so again, our protocols come into play in this area. Bwana DG, I think you can touch on to these issues. Perhaps the final issue would be on Zainab's question on financing when it comes to HIV, TB, and malaria. We've seen the reports in the media and internally within the ministry. There is a KCM secretariat, that's the Kenya Coordinating Mechanism Secretariat, that continues to meet to be able to ensure that there will be no loss of funds. So at this point, there's no loss of money that has happened in terms of the grants. The grant process is ongoing, and I'm aware the teams are actually making progress in terms of being able to ensure that the process is aligned to global fund regulations. So thank you for that. DJ, you can jump in.
Thanks, Madam CAS. Regarding the issue of the gatherings, just to add, remember also the way the infection spreads is that you require about, on average, it takes you 3 to 5 days before you develop the symptoms, though the range is from 1 to 14 days. I don't know when the rally took place in Mombasa, but I doubt whether it is past 6 days, in which case you can be able to ascribe whatever numbers you are seeing in Mombasa to that particular event. Yes, true. Spirit says yesterday the world recorded the highest single number of COVID cases at 300,000. And this tells you that the disease is still here with us, and therefore we need not lower our guard in terms of implementation of the public health social measures that we have continued to articulate. This also means, therefore, that challenges regarding testing going forward will still persist, because if you have higher numbers like that, then globally the need for testing, of course, is increased. And if the need for testing is increased, of course, the global supply chain challenges still persist. In terms of the curve, the trajectory of the curve has been on a downward trajectory, but this will only obtain so long as we maintain and sustain the public health social measures that we have continued to articulate, failure to which there could easily be a reversal. And you remember His Excellency talked of the point of inflection, when we reach that tip, but then you loosen your guard, then you can easily reverse the gains that you have made. So it is imperative, and we continue to plead with fellow Kenyans that we continue to maintain these measures and even enforce them harder going forward. In terms of the testing, we are implementing our new testing strategy, but also WHO is working together with other development partners through what we call accelerated COVID-19 tools. This is supposed to help us in terms of developing therapeutics, diagnostics for COVID-19. And so far, out of a budget of about 37 billion, WHO has been able to raise $3.5 billion out of an estimated 37 billion shillings required. Because of this, you have seen a race towards development of vaccines, therapeutic agents, and many other interventions that will help us in fighting this pandemic. As of today, there are about 180 vaccines in trial, and this tells you clearly the progress that the world has made in terms of research development in trying to mitigate the effects of COVID-19. For our recovery rate, that stands at 64%, compared to the global, which is about 72%. Remember, as a country, we are at the forefront implementing community level. So sometimes reporting lags behind, and therefore you could say that our reporting rate or our recovery rate is lower than the global. But I believe if we get the reporting correct, isolation care. Today we have 486 patients in different facilities across the country. And on the contrary, we have about 1,681 patients under home-based care. So going forward, as these patients make their full recovery, again, this trend will reverse with more recoveries coming from the home-based care platform compared to the institutional capacity. I can be able to give you data on the children who have been infected and how many have succumbed. But of importance is that the age group that is most affected by COVID-19 is those aged 30 to 39 years, and this constitutes 33% of the case load. Regarding the variants or the discordance, as Madam CAS indicated, we could be at different stages of the infection, and therefore, if I'm on the recovery path, I may not be infectious to be able to infect my spouse. So the fact that my COVID-19 test turns positive, because remember we are using the PCR, which picks part of the viral particle, but it does not tell you whether it is infectious or not. So I could test positive today, and 21 days positive. 21 days I can be able to pass the COVID-19 to you. And that is what informed the change in our discharge protocol from the previous mandatory 2 tests after the 14 days to that one of just looking at your symptoms. If you are asymptomatic, then you can go home after the 14th day or 10 days plus 3 thereafter. Lamnat asked about the curve. Yesterday our positivity rate was 6.1. So again, that takes us to the drawing board. What is important is that we are not going to look at this parameter alone, but to look at it together with others, including The number of cases that we have in our health facilities and the resilience of our healthcare system, the number of critical care cases, which has continued to decrease. As of today, we only had 22 people under critical care, 15 on ventilator support, and 7 on supplemental oxygen. And remember, at a point when, especially when we are approaching or at our peak, we are reporting more than 60, 70 people under critical care. You have also seen that today we have less than 500 people in institutional care for COVID-19. So together with these curves, we can be able to, with these figures, we can be able to say clearly that we are making progress, but we should not drop the ball. We need to sustain and maintain the public health social measures that we have put in place and we continue to articulate. Otherwise, these changes can easily be reversed. For your information, today, Israel again, the Prime Minister announced that from Friday, they are going into a total lockdown again for 21 days. We don't want to go that direction. So let's continue to carry these simple measures so that we vanquish this virus once and for all. I thank you.
Thank you, DG. Thank you all.